Selegiline Hcl Tablet, Disintegrating is used in combination with levodopa/carbidopa to treat movement disorders caused by Parkinson's disease. It doesn't cure Parkinson's, but it can help improve shakiness, muscle stiffness, and sudden switching between normal movement and stiffness. It may also improve your range of motion and ability to walk, dress, and exercise. This medication works by slowing the breakdown of certain natural substances in the brain, such as dopamine, norepinephrine, and serotonin. The recommended daily dosage and optimal timing for taking this medication should be discussed with your healthcare provider. When taking Selegiline Hcl Tablet, Disintegrating, follow your doctor's instructions and dissolve the tablet on your tongue once a day in the morning. Do not swallow the tablet or the dissolved medication with saliva or water. It should be absorbed through the lining of the mouth. To prevent accidentally swallowing any of the medication, do not eat or drink anything for at least 5 minutes before or after using this product. Be sure to dry your hands before taking the tablet out of the blister pack. Place the tablet on your tongue and allow it to dissolve completely. Do not crush, split, or break the tablet before taking it. Do not remove the tablet from the blister pack until just before taking. Your doctor may adjust your dosage based on your medical condition and response to treatment. It's important to use this medication regularly at the same time each day in order to get the most benefit from it. Don't stop taking this medication without consulting your doctor, as some conditions may become worse when the drug is suddenly stopped. It may take a few weeks for the full benefits of the drug to be noticed. If the medication stops working well or if your condition worsens, talk to your doctor. And remember, taking Selegiline late in the day may cause trouble sleeping. Possible side effects of Selegiline Hcl Tablet, Disintegrating include dizziness, abdominal pain, dry mouth, nausea, stomach upset, trouble sleeping, and headache. If any of these effects last or get worse, notify your doctor or pharmacist right away. To reduce the risk of dizziness and lightheadedness, get up slowly when rising from a sitting or lying position. If you are also taking levodopa, you may experience more side effects from the levodopa when taking Selegiline. Tell your doctor right away if any of these side effects occur: nausea, shakiness, muscle stiffness, mental/mood changes such as hallucinations/abnormal dreams. Some people taking Selegiline have fallen asleep suddenly during their usual daily activities. If you experience increased sleepiness or fall asleep during the day, do not drive or take part in other possibly dangerous activities until you have discussed this effect with your doctor. Tell your doctor right away if you have any serious side effects, including fainting, loss of balance, mental/mood changes, unusual strong urges, worsening muscle stiffness/twitching, changes in sexual ability/interest, increased shaking, swollen ankles/legs, difficulty urinating, unusual weight gain, easy bleeding/bruising, black/tarry stools, vomit that looks like coffee grounds. This drug may rarely cause an attack of extremely high blood pressure which may be fatal. Get medical help right away if any of these serious side effects occur: frequent/severe headache, fast/slow/irregular/pounding heartbeat, chest pain, neck stiffness/soreness, severe nausea/vomiting, sweating/clammy skin, widened pupils, vision changes, sudden sensitivity to light. Selegiline may increase serotonin and rarely cause a very serious condition called serotonin syndrome. Get medical help right away if you develop symptoms of serotonin syndrome. A very serious allergic reaction to this drug is rare. However, get medical help right away if you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, severe dizziness, trouble breathing. If you notice any other effects not listed, contact your doctor or pharmacist. Before taking Selegiline, talk to your doctor or pharmacist if you have any allergies, as this medication may contain ingredients that can cause allergic reactions or other problems. Before using this medication, tell your doctor about your medical history, especially if you have certain adrenal gland tumors, cerebrovascular disease, heart problems, bleeding problems, peptic ulcers, severe or frequent headaches, diabetes, mental or mood disorders, high blood pressure, kidney disease, liver disease, or an overactive thyroid. This medication may make you dizzy or drowsy, especially when combined with alcohol or marijuana. Avoid driving or using machinery until you know how this medication affects you. Limit alcohol consumption and talk to your doctor if you use marijuana. Before having surgery, make sure to inform your doctor or dentist about all the products you use, as you may need to stop taking Selegiline before surgery. This medication may contain aspartame, so if you have phenylketonuria or any other condition that requires you to restrict your intake of aspartame, consult your doctor or pharmacist before using this drug. Older adults may be more sensitive to the side effects of this drug, especially dizziness from low blood pressure. During pregnancy, Selegiline should only be used when clearly needed. Discuss the risks and benefits with your doctor. It is unknown if this drug passes into breast milk, so breastfeeding is not recommended while using this drug and for 7 days after the last dose. Consult your doctor before breastfeeding. If you are taking any of the following medications, this may interact with Selegiline: antidepressants, other MAO inhibitors, appetite suppressants, drugs for attention deficit disorder, certain herbal products, cold medications and nasal decongestants, street drugs, stimulants, supplements, and certain triptans used to treat migraine headaches. There is an increased risk of serotonin syndrome/toxicity if you are also taking other drugs that increase serotonin, such as street drugs, certain antidepressants, and certain opioid medications. Be sure to tell your doctor or pharmacist if you are using any of these medications before, during, or within 2 weeks after treatment with Selegiline. Also, discuss with your doctor how much time to wait between starting or stopping any of these drugs and taking Selegiline. Do not increase your dose in order to prevent a serious high blood pressure reaction. Also, follow any special diet your doctor or dietitian recommends to limit your intake of tyramine while taking this medicine. Foods and beverages that are high in tyramine include aged cheeses, dried/aged/fermented meats and sausages, preserved fish, products containing large amounts of yeast, fermented foods, most soybean products, broad/fava beans, red wine, and other specific foods. Finally, be aware that this medication may interfere with certain medical/lab tests, such as brain scans for Parkinson's disease, possibly causing false test results. Make sure lab personnel and all your doctors know you are using this drug. If you or someone else has taken too much Selegiline HCl tablet, disintegrating and are experiencing serious symptoms like passing out or difficulty breathing, it's important to seek medical help right away. In the U.S., you can call your local poison control center at 1-800-222-1222. If you're in Canada, call a provincial poison control center. Symptoms of an overdose may not show up for up to 12 hours and can include restlessness, weakness, drowsiness, flushing, sweating, fast heartbeat, confusion, and seizures. After a suspected overdose, you may need to follow a tyramine-restricted diet for several weeks. It's important not to share this medication with others. It's also important to have regular lab and medical tests, such as checking your blood pressure, while you're taking this medication. Make sure to keep all your medical and lab appointments and consult your doctor for more details. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, skip the missed one and take the next one at the usual time. Don't take a double dose to make up for the missed one. Remember to store the blister packets in the pouch provided and keep them at room temperature, away from light and moisture. Make sure to keep all medications away from children and pets. If you have any remaining tablets in the blister packets after 3 months of opening the pouch, it's important to discard them. The medication may no longer work after this time. When it comes to discarding this product, do not flush medications down the toilet or pour them into a drain unless instructed to do so. Instead, consult your pharmacist or local waste disposal company to properly discard the product when it is expired or no longer needed. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.